360. I'm Heidi Schweighofer. Today, my guest is Dr. Angela Che. Dr. Che has been a guest in the past, and we talked about hair loss. And today, we are going to talk about some cosmetic, non-invasive procedures that we can use as we grow older. Dr. Che did her undergraduate work at Princeton. She obtained her master's in public health at Yale University, and then got her medical degree from Case Western Reserve. She's also on the faculty, I don't know if you still are, but was on the faculty at the Cleveland Clinic School of Medicine. And now Dr. Che got her own practice. It's called Cosmopolitan Dermatology. It's up in Shaker Heights. And that business information will be at the very end of the show. So if something you hear sparks your interest, you'll be able to reach out to her with that information. So let's get started. One of the things that I want to talk about specifically are different procedures we're going to start with the face. So thank you, Dr. Che, for coming and for being here.
I'm excited to be here.
Now, we all have aging, and most of us don't want to look like a supermodel, but I know that there are procedures that can be done that will enhance our looks and maybe diminish a little bit the signs of aging. So what I thought I would literally do is kind of go down the list and have you talk about each one.
Absolutely.
Let's start with fillers.
Okay.
I see pictures of face fillers, lip fillers. I don't know where else people are getting fillers. Talk about, do they hurt? Do they work?
Fantastic. I do a lot of fillers. Fillers is just another tool that we use to just, again, give you a more refreshed look. You want to be the best version of yourself. We're not trying to make you look different, like somebody else, but we want you to, look in the mirror and feel, confident, right? You want people to say, oh, you look refreshed this morning, not, oh, what did they do, right?
You look tired.
Yeah, or she must have had something done. There's the superstars. I don't know if you guys have seen a picture of Madonna lately, where the entire face is so distorted and filled. You don't want that.
You don't recognize her.
You don't recognize her. That is not the type of cosmetics we're talking about here. We're talking about enhancing your natural features and making you look refreshed. That's the best type of cosmetics. And fillers is just one tool we use to do that. Filler is exactly what it is. It fills. It fills crevices, right? It gives you volume in your cheeks. The cheek is one of the areas we fill all the time, because as we get wiser, I like to say wiser, as we get wiser, this structure here kind of diminishes a little bit. It gets weaker, the face falls, and then you get this deep, here, falls down, and you get the deep groove here, and you get the lines here. And you get the big jowls here, right? Yes. People come in and like, oh, I have so much jowl here. I don't like the fat. My jawline is no longer defined.
Right.
So that's what happens as, time occurs as we get older, and filler is a tool to kind of dial that back a little bit. So, we put cheek fillers in here, and it's a very, very simple procedure that helps to make the cheeks appear fuller. And when the cheeks fill, this area also lifts. It gives you more support.
So you're not putting them in here, you're putting them out here.
That's an indirect way of addressing the lines here. Because when we get older, this falls. And when it falls, we create that line.
Yeah.
So if we can give you some of that support back, then this lifts automatically, okay? So putting cheek fillers here lifts the lower face up a little bit, okay? It is true we do use fillers here as well. If the lift wasn't enough, we can do fillers here, and then of course our mouth, our mouth falls as we get older.
Yes.
So we can put filler here as well.
Down here, in the wrinkles down here.
In the wrinkles down here. We can even put fillers around the wrinkles around our mouth. And when we say filler, I'm sure you guys have heard of Juvederm,
Yes.
Restylane. Those are the more common brands that we use. There's RHA. There are many brands out there. The filler that I use is a hyaluronic acid filler. There is other types of filler, you know, poly L-lactic acid filler, calcium hydroxyapatite. The safest and most forgiving filler is hyaluronic acid.
Now, what do you mean by forgiving?
Forgiving means you can reverse it, right?
Okay.
If you don't like it, it can be reversed. You know, there's a product called hyaluronidase that, you know, for example, if we do a filler and you're like, you know what, it's too cheeky, or I don't like how it came out, I can just inject it and it will dissolve the filler. So it's very forgiving. You know, you're not stuck with it for life. It's also not permanent. Depending on the filler that you use, it can last up to 6 months to about 2 years.
No kidding.
Right? Yeah, absolutely.
Oh, I thought people were going like every 4 months or something.
No. That is Botox.
Okay,
And we will talk
we'll
about
get
Botox.
to that in a minute. Yeah.
But again, hyaluronic acid is a product that your body, your skin naturally makes. You know, you make your collagen, your fibroblasts, those are cells in your skin, make hyaluronic acid. And that's what gives you the look of plump, like your skin looks full. Because hyaluronic acid allows your skin to naturally absorb water, right? When, you know, instead of looking kind of, you know, sunken and wrinkled, it fills, it absorbs water. And so that's what that product does.
So then it's a safe product to be injected. Not that you would not, you know, you would use anything unsafe, but does it feel like plastic going in?
Excellent question. There are many different, you know, the different fillers have different properties, but by far the fillers are meant to look natural, right? The fillers I use, if I fill it, you're not stiff there. It's not like not moving. When you move your face, the filler moves with your face. So it looks very natural.
Okay.
Right? And that's why people are attracted to it. The most popular cosmetic procedures are Botox and fillers, right? Because little downtime, little risk, and a lot of payoff in terms of the results.
Does it hurt?
Excellent question. We do use a needle, a very tiny needle, to inject the filler, and most of the filler has good injection. Most of the fillers have lidocaine in it, which is a numbing agent.
Oh. So
it's already in the filler, so as I inject, it numbs. And I even go, you know, if you're very, have a very low pain tolerance, or you just, the thought of a needle scares you, we put topical numbing on. And you sit for about 15, 20 minutes, and then we do the injection. And it's very tolerable, even for the people who are very afraid of needles.
Sissy pants. Yeah, like me. Okay.
Novices, like people who've never done it before and they're a little hesitant. You know, we try to handhold through the process, and in no time you're going to be loving it and wanting more, right? Because the results are, you know, very pleasing, and again, when it's done correctly, it makes you look like your best self, rested, you know, glowing. Again, not like somebody else. You don't want to distort your features, your natural features. And in the best of hands, that's what filler does. It gives you a refreshed version of yourself.
Dr. Che, I read this article online yesterday about women actresses who had, quote, overdone the fillers, and it showed them before, and then they had some of the removal done. Why would why would someone over-inject, like why would they keep doing it and doing it and doing it so that they ended up looking like Madonna now?
It's an excellent question, and this does happen. There is a condition called body dysmorphic disorder, where some patients become addicted to putting things in their face. All right, I had one patient. There are times when a physician has to say no, right? And I've said no to some patients. This particular woman, a very educated woman, many years ago came to see me. She had come in and her face was filled. I mean, the cheeks were enlarged. it was obvious to me she was, getting things done all the time, and she wanted me to add more to it. Now, this is where, the art of medicine comes in. You have to see what is happening. There are some psychological issues there, and you want to be able to say, you know what, adding more may not give you the results you're looking for.
That's a nice way to say it.
Adding more may not give you the results you're looking for. And I don't think I can improve what you have, right? Because there is such a thing where patients, once you start doing these procedures, sometimes you notice, you fix one thing, and then now you notice something that you've never noticed before. And it becomes this thing, well, you did this, but what about this? Oh, what about that? And it can sort of snowball. And there comes a time you have to pull back and say, what's going on? What am I doing? And in my opinion, the provider who's giving you these procedures needs to be able to have an honest conversation about maybe this is not helping, and maybe I will not, what I'm able to offer will not enhance your looks. Now that means you've lost the business, but that is good because
it's ethical.
It's ethical. And somebody's going to look at that woman and say, who did your stuff for you? And,
that's right.
That is not going to be a flattering thing for them to mention your name. I take pride in what I do. The whole point of cosmetics is to lift people's spirits up, make women feel confident, make them happy. And it's for them, it's not for anybody else. So when it becomes something else, you gotta reassess why you're doing what you're doing, right?
Don't you think that all of the pictures of people who are perfect online, perfect looking, and in magazines, perfect looking, not a wrinkle, not a tummy bulge, not a nothing, are making us all a little nuts? Like we should look like that.
Yeah,
even when we're 71, which I now am, I should look like that.
Yeah.
I don't know. It seems like it's gotten out of hand.
It's gotten out of control, and it is up to each and every one of us to sort of rein it back a little bit.
I think so too.
There is something to be said about authenticity and looking like yourself, and not everyone looking the same. Sometimes you go through these, practices for cosmetics and everybody looks the same.
Oh,
you wanna retain your individual beauty, and there is beauty in looking like yourself.
Yes.
And the best cosmetics just brings that out more, right?
I'm so glad to hear you say that. I'm glad. I think that there does come a point where you, as the provider, I'm so glad to hear you say, you're saying to patients, this may not help.
Yes, and it's the truth. I mean, sometimes you have a distorted look of what, idea of what can be achieved with these procedures. When a patient comes in, and sometimes they even have a picture of, I want to look like this, right? A celebrity,
Kim Kardashian, God forbid.
And I have to say, this is what is possible with what I can do. You do not want to overpromise. You do not want to give them a false impression of what is possible. If being honest is not, you get the sense that they're not going to be happy, don't do it.
Yeah.
Send them to somebody, maybe surgery, plastic surgery, something to that level. What I do is non-invasive, extremely safe, and it's quick. It's not surgery. It's not distorting. It's not changing structures. If I assess that I cannot give you what you're looking for, it's best to send you to someone who can.
Yeah.
All right.
Yeah.
And that's part of it. That is part of it. And when you're looking for a provider that does these things, this is the kind of thing you should look for.
Oh, amen.
Yeah.
Amen.
Yeah.
All right. Well, let's talk about the things. Another thing that you can do to enhance. And I know everyone in the world has Botox right now. I don't right this minute, but let's talk about. I've heard women worry that it's toxic, which it is. Does it hurt? Does it work? Forehead, where else do people get it?
So first, I'd like to distinguish between fillers versus Botox.
Yeah.
Filler, as we talked about, fills wrinkles, it fills crevices, it fills lines. It's a filler, right? Botox relaxes the muscle. It makes the muscle not able to contract. So filler deals with skin, Botox deals with muscle. Right?
Oh, okay. That's a good way of looking at it.
So Botox is a product that we inject into your muscle to prevent it from contracting. So, you know, the most common location for Botox is what we call here the glabellar, the frown, you know, line, where it's often referred to as the number 11. So you frown. What am I doing? I'm contracting my muscle, right? And you make those lines, and over time, that line becomes permanent. Even when you're not frowning, the lines are there. And so Botox comes in, we inject it, and it just prevents the muscle from responding to you when you frown, right? And it's temporary. It's only it lasts about 3 to 4 months. And again, it's meant to prevent that line that you make from eventually just being there. It gets etched in over time. So Botox acts on the muscle primarily, whereas filler fills crevices, you know.
All right.
All right. So the most common location for Botox is these lines. We have the crow's feet. Those are the lines, the smile lines. You smile and it makes those lines here around the eyes. We also have forehead lines where you look up and you make the fans. We call them the fans. And you make the lines, you look up and you make these lines on the forehead, all right? Some people have it really strongly. And some of this is genetic, you know. My own father, when I look at him, I mean, those lines are there, so what do? I Botox myself.
I was going to say your forehead looks
so
fabulous.
that I don't develop it, because I know I have you know, some of the genetics for it. So Botox can be used as a prevention, because once those lines are in, they're in, you can fill it. Now it becomes a wrinkle, right? You can fill it with a filler, but there are a lot of, you know, people out there who have not yet gotten that line and they don't want to get that line. So you do the Botox so that it doesn't become permanent. The line doesn't become etched in, so to speak. So again, Botox prevents the lines that form from movement of your face. You smile, you make the lines here, you know, because movement requires muscle contraction, right? So if we relax that muscle a little bit, you don't contract, you don't make the lines. Most common locations here, right? The glabellar, we call it here, the forehead line, the lines around the eyes, the crow's feet. Some people smile and they get like lines around on top of the nose. We call them the bunny line right here. And so we can Botox it. You know, and sometimes we do a little Botox here. Even the lip, there's something called a lip flip where we can put just a little drop of Botox on the upper lip and it gives you the appearance of a slightly fuller lip.
Oh my God.
Right. Yeah, so there's a lot of fun things to do with Botox, and it's very safe to do.
Do you, what are the side effects? Every now and then one hears about it migrating to an eye or something. I really have, and is it painful? I always am going to ask that question for everything.
So this is another injection, right? We have to inject the product into the muscle. So you're going to feel a little prick. It's minimal.
Yeah.
It's minimal. Side effects really it's possible you can get a headache. Maybe at the injection site, you might get a little bleed there, what we call a hematoma, a very minor bleed that goes away. But really, the side effect that you want to worry about has to do with, you know, the person doing the Botox. You need to know your anatomy.
Exactly what
you need to know your anatomy. So if you go to someone who's just reading a book and it says inject here, here, and here, and yet your anatomy is different, you're not going to have optimal results. So the forehead is one location that can go wrong quite a bit. If you inject too close to the eyebrow, the Botox can droop your eyes, okay? Your eyebrow can fall and you look tired, right? Droopy eyebrows, droopy eyelids. That happened
to Simon Cowell on Good. Did you ever see him on America's
I've heard,
Got...
but I never saw it, yeah. So you want to be careful. when I'm injecting the forehead, I always tell patients, the lines may not completely go away, because in order for that to happen, I would have to go a little lower, and you can get droopy eyelids or eyebrows. So that can be avoided. When that happens, I've had patients come to me where their the eyes are almost closed from Botox.
Yeah, that's what he looked like. I'm not kidding.
We can give you eye drops to open your eyes a little bit more. So there are ways of addressing that. But this is where, again, you want to go to a provider that knows what they're doing, that have done it quite a bit, and knows how to address the complications. It is true, complications can happen even in the best of hands, but the key is go to someone who can, address it and address it in a kind manner and say, oh, this happened, come in, I'm going to do this to help you. Right?
And frankly, I will just say, should be a physician also, not a nurse clinic. And I know I'm now dissing every nurse clinic, but I prefer knowing there's a physician that is doing it, who does know the anatomy and knows what to do if there's an issue.
I'll just say there's a lot of providers out there that do Botox and fillers. Some of them are nurse practitioners. And the key is experience. And, experience comes with knowing your anatomy, what having injected a lot of people and knowing what you're supposed to do. So I just say, make sure whoever is doing your procedure is experienced. There are ways of finding it out. It's credentialed. You got to do your homework, because this is your face, right? This is one time you don't want to skimp. There are times to maybe look for the deal somewhere, but this is your face. This is what you present to the world. You don't want it messed with. You want to be in the best of hands.
I hear about Botox parties. I'm just appalled that. But anyway, all right. So now I'm going to ask about. We don't have enough time. Yeah. Now I want to talk about chin and lower face, and I want to ask you specifically about Morpheus. Is that the full name of it? Morpheus.
Yes, Morpheus.
Okay.
So there's a technology that uses microneedling. These are tiny, tiny little needles, and couple it with energy, radio frequency energy. And it is used to help tighten the skin, because remember, as we get wiser, things fall, right? It's used to tighten the skin. A lot of people have these jowls in this area. This technology, the energy heats up the skin, and as it does that, it tightens. And it addresses fine lines and wrinkles. It can also even coagulate fat. That means it can sort of remodel fat in this area if you have jowls that are just kind of hanging, or you feel like this area is full, whereas this area is not. So that's a non-invasive treatment. You come in, we numb, because if you go online and read about Morpheus, one of the things people talk about is it hurts. And it is true. Again, you want to be truthful. When patients come to me and they want to do Morpheus, I tell them it hurts, so we have to numb you. We numb you for at least an hour. Topical numbing. While you're numbing, we give you something to read, the TV is on, bring something to do, is no problem. Just numb so that the procedure is comfortable. And when I'm doing Morpheus on someone, I ask you, what are your main areas of concern? If it's the jowls, that's where I'm really gonna hammer it. Sometimes people, don't like the wrinkles around their eyes. Those are the areas I go first to make sure I'm addressing what you're concerned about, right?
So you don't just automatically do the whole face. If I say I don't like this, you would do this.
Yeah, there are ways that different providers sort of market Morpheus. I think it's best to do the whole face, but I will be more aggressive in the areas of most concern. Sometimes people come and they would just want to do around the eyes because of the lines around the eyes. We will do just around the eyes. Some people come and it's the neck, because Morpheus can dial again into fat and help with a fullness, a full neck here. It can also tighten. So it has multiple advantages. It's one machine, but you can, if you're really good at using it, you can dial it to help with fat. You can dial it to help with tightening. You can dial it to help with acne scars. I have a lot of patients who come in with scars from acne that wasn't treated. It can dilate for fine lines and shrink the pores. It also brightens the skin. It has a lot of advantages. That's why it's a popular treatment. And Morpheus is just one machine that combines radiofrequency energy with microneedling. There are many others. It's just one that is very powerful.
You said it hurts. Is there downtime?
Typically within, you will walk out of my office a little pink like you had a sunburn, right? Your skin will be, pinker, like you had a sunburn. And over 24 hours, most people recover from that. It all kind of depends on how aggressive I am, all right? If I'm super aggressive around the eyes, there can be bruising. Something you can put makeup on as it heals. If I'm aggressive around the jawline because I'm trying to dial back fat, you can have bruising, and you can put makeup on that. And I counsel you through all of this. You should know all the pros and cons of a treatment before you jump into it. And so if you have a wedding coming up next week, you may not want to do Morpheus on the Friday before, right? Because you have some recovery to do.
When do you see results of Morpheus?
Excellent question. One of the things about Morpheus is, remember that it is a natural treatment. It is making your body create collagen and elastin to tighten. It's causing your body to make more of what it's lost over time. So it takes time. When you are heating up the skin, when you are using microneedles, you're intentionally creating tiny, tiny, tiny little injuries to your skin and, allowing your skin to heal. And when your skin has to heal, guess what it does? It deposits collagen, it deposits elastin, and it makes your skin make more of what you've lost.
Okay.
So it takes time. Within 2 to 3 weeks, most people notice a glow. Their skin is brighter, it glows, you have that glow up. But for that collagen to build up, it takes usually the 3 treatments about a month apart, for that to build up, for you to see a noticeable improvement.
So if you were going to a wedding or a college reunion, you'd want to do it maybe 6 months ahead even.
Excellent, exactly.
Okay.
Plan ahead so that you plan it such that you see the optimal improvement just when you are going for your event. Yeah, so unlike fillers and Botox where the results are, pretty quick, this is a natural treatment. You're making your skin make more of what it's lost, so it takes time to get it. Botox, when I do Botox, depending on which one I use, within 2 weeks you have your results. When I do filler, you can see some of the results right there. Those are immediate gratification procedures, whereas, Morpheus takes some time.
We have all of 1 minute, which I just knew was going to happen, and we didn't go through everything. But if you were to sit here right now and suggest Joe, woman with 70-year-old face, and she wants to look enhanced, not fake, you'd probably be thinking, tell me if I'm wrong, some Botox maybe some fillers, and or maybe Morpheus.
Absolutely. I call it the non-invasive facelift. Okay.
Yeah.
I start with a microneedling device, Morpheus, possibly. I have several devices that do that, to make your skin make more of what it's lost. It's a natural process where I'm trying to get your skin to pick itself up, to make more of your own collagen, your own elastin, to shrink your pores, to smoothen it. After that, I layer on a little bit of filler right in here if you need it, in the areas where there are crevices, maybe give you a little bit more of a lift here, and then I Botox a few areas. By the time I'm done, the results, you're looking fantastic. You just didn't fill one area, you've addressed the entire face, and people will look at you and just, be amazed how you look, but you look like you. You look like the best version of yourself.
Not like Phyllis Diller. Do you remember with the surgeries?
Yeah. And we all know when people have overdone it, right? You don't want the duck lips. You don't want you don't want to overdo it. Yeah.
I think most women that I know my age do not want surgery. Maybe they do, but at least people I hang out with. They just don't. That's too much. And there's nothing wrong with aging. Doing a little twerk here and there and
it's fun. It's fun. It makes you feel better. And again, it's non-invasive.
No one can tell except you.
Right. Nobody knows. And you feel better. Remember, the reason for doing these things is for you. When you feel better, the confidence you exude affects every aspect of your life.
Yeah, that is so true.
You know, you go to work, you're happier. You know, you're a nicer person.
That's
because you feel good. You look good.
And you do feel confident. That is so true. Yeah. Oh, I wish we had more time, and I'm so sorry we ran over. I knew this was going to happen the minute Dr. Che sat down, because I find this information is something that I find very fascinating. I don't want to have a big facelift, but boy, there are things out there that can truly enhance how you're looking and you're feeling. So thank you so much for watching. And again, her business information will be at the very end of this show. Have a good day. Bye-bye.